In this module, we want to emphasize the importance the mutual health program places on mothers and expecting mothers. As with any other sharing request, expectant mothers pay a single unshared amount for all eligible expenses related to their maternity sharing request. Eligible expenses may include miscarriage, hospital, home birth, prenatal care, mother's complications, postnatal care, and delivery. The maternity sharing request must be submitted within 15 days of the date of pregnancy confirmation. Once the maternity sharing request is opened, original itemized medical expense bills must be submitted within 6 months of service, or limitations may be placed. Limitations include interest fees, late penalties, or any reduction of the final bill lost due to the delay in providing the documentation to mutual health. Pregnancy existing prior to membership is not eligible. Newborns must be added to the membership. Finally, members with costs not exceeding $10,000 for delivery, postnatal, and prenatal expenses. Mutual Health will reduce the unshared amount responsibility by $1,000. Here we look at some other maternity requests. For miscarriage, any expenses related to a miscarriage associated with an approved maternity sharing request are eligible if the costs exceed the UA. Any newborn complication occurring after birth, whether the complication existed before or after birth including congenital conditions, is separate from the mother's maternity sharing request and will require its own sharing request and unshared amount. For children born from an eligible maternity sharing request, sharing is limited to $125,000 for medical bills related to congenital conditions after the initial hospital discharge. For NICU admission, the time limit for sharing is 35 days after birth. In addition, as a one-of-kind offering, Mutual Health will order a 6-month supply of disposable diapers after delivery. Members receive 1 case of diapers a month for 6 months. The following are eligible for up to $6,000 per maternity request. Mutual Health recommends collecting a prenatal and postnatal prepayment package from your clinician. Prenatal and postnatal allowances include, but are not limited to pelvic services, breast pumps, and lactation consultants. Here you can see the eligible delivery services with no sharing limits. Below those, you see the list of services not eligible to be shared through a sharing request including abortion, birth control, elective procedures, IVF, surrogacy, and transport. Contraception and genetic screening and testing are eligible only if it is required to treat an approved sharing request. Elective sterilization, such as tubal ligation, vasectomy, and preventive hysterectomy, is not eligible.